Thank you so much, Jigme. Namaste, a very good morning, good afternoon, and evening to everyone. Thank you so much for joining us this special book launch program. Today, I am honored and excited to share a guidebook that we believe is meaningful, empowering, and long overdue, an essential guide for the lesbian, bisexual, and queer women on dignified menstruation. It is a collaborative effort by Freedom and Rome, Uganda, and the Global South Coalition for Dignified Menstruation. I would like to take a moment to express our gratitude to Amplify Change for fostering the connection between Global South Coalition and Dignified Menstruation and Farooq that made this work possible. This publication was written voluntarily and wholeheartedly by Dr. Radha Paudel with the aim of supporting Farooq in integrating the dignified menstruation approach into its work. This guidebook is more than a manual. It is companion, a conversation starter, and a source of validation for many who have been too often felt unseen and misunderstood. This is designed to empower lesbian, bisexual, and queer women who are born with the uterus and ovaries, who are frequently facing unique struggle and discrimination because of their sexual orientation. This book is written in a question and answer format to make the information accessible, logical, and relatable. Every response is grounded in the principle of dignified menstruation and the rights of LGBTQ women. This guidebook is more for anyone who wishes to use dignified menstruation as a cross-cutting theme or who seek to adapt it as an innovative, holistic, transformative, decolonized, and human rights-based life cycle approach. My hope is that you read this guidebook, you will engage it with openly and reflectively, whether it affirms your personal experience or broaden your understanding of others. I believe it has something meaningful to offer each one of us. Thank you so much for listening, and I hope this book inspires meaningful conversation and deeper connection within ourselves, among each other, and across our communities. Thank you.
Thank you, Sapna, for a wonderful sharing. Again, we have another launch, and now we are going to launch a report, and this is going to be the report on menstrual discrimination among trans men. So in order to launch this report, I would like to call again Avali Khare, 𝐃𝐢𝐿𝐻𝐴, Lada Strelkova, and last but not the least, Shahi Thakuri. Please come on the dais. So this is a report on menstrual discrimination among trans men. Okay. So we just launched the book, a report on menstrual discrimination among trans men. Now we'd like to again call upon, who's already on the stage, Shahi Thakuri from Unity for Change, for the presentation on dignified menstruation among trans men. So over to you, Anu.
Thank you, sir. So, hi everyone. My name is Shahi Thakuri, and I identify myself as a transgender man, and my pronouns are he, him. So, I'll speak Nepali throughout this session. नमस्ते सबैजनालाई। मेरो नाम अनु शाही ठकुरी हो। म कालीकोटबाट र म अहिले आफूलाई पारलैङ्गिक पुरुष भनेर चिनाउँछु। ओके, सो यो चाहिँ एउटा डिग्निफाइड मेन्स्ट्रुएसन ट्रान्स मेन्स्ट्रुएसनलाई लिएर एउटा सर्वे भएको छ, रिपोर्ट भएको छ र त्यसको बारेमा म भन्छु। तर त्योभन्दा अगाडि चाहिँ मैले अलिकति आफ्नो बारेमा पनि भन्न चाहेँ। सरी। सो हामीले चाहिँ मेन्स्ट्रुएसन यो शब्द सुन्ने बित्तिकै चाहिँ पहिलो वर्ड चाहिँ हाम्रो दिमागमा आउने भनेको पहिलो एउटा चित्र चाहिँ महिलाको आउँछ दिमागमा टक्क। एउटा महिला आएर दिमागमा बस्छिन् अनि त्यसपछि बल्ल भजाइनाको चित्र आउँछ होला, त्यसपछि बल्ल पाठेघरको चित्र आउँछ होला। तर हामीले किन मेन्स्ट्रुएसन भन्ने बित्तिकै पहिला पाठेघरको चित्र हाम्रो दिमागमा किन आउँदैन, महिला नआएर? किनभने हामीले मेन्स्ट्रुएसनलाई एउटा स्पेसिफिक जेन्डरमा मात्र राखेको छौँ। त्यही भएर पनि सायद यो सिस्टमेटिक उसले प्रोसेसले पनि गर्दा होला र हाम्रो सोसाइटीले हामीलाई के सिकाएको छ भन्ने तरिकाले पनि होला। म पनि सानो हुँदाखेरि चाहिँ महिनावारी भन्ने बित्तिकै महिला मात्र हुन्छन्, महिला सम्बन्धी मात्र विषय हो यो, महिनावारी विभेद चाहिँ महिलाको मात्र इस्यु हो भनेर बुझ्थेँ। सो मैले चाहिँ मेन्स्ट्रुएसनको बारेमा कहिले थाहा पाएको भनेपछि म 5 वर्षको थिएँ। 5 वर्ष हुँदाखेरि चाहिँ मेरो मम्मी छाउगोठमा बसेको मैले देखेँ पहिलोपटक। त्योभन्दा अगाडि मलाई थाहा थिएन किन बस्नुहुन्छ, के को लागि बस्नुहुन्छ भनेर। तर जब मैले फर्स्ट टाइम मेरो मम्मीलाई सोधेँ कि तपाईँ किन छाउगोठमा बस्नु भएको भनेर, अनि उहाँले भन्नुभयो कि म चाहिँ पर सरेको छु, त्यही भएर म छाउगोठमा बस्नुपर्छ भनेर भन्नुभयो। पर सरेको के हो भनेर सोधेँ, तर मेरो मम्मीले मलाई भन्नु भएन। पर सरेको कसलाई भनिन्छ, किन सर्नुहुन्छ पर, कसरी सरिन्छ भन्दाखेरि चाहिँ मेरो मामुले चाहिँ मलाई भन्नु भएन। त्यसपछि मेरो दिदी पनि मेन्स्ट्रुएसन हुनुभयो। मेरो दिदी पनि महिनामा 5 दिन 6 दिन त्यसरी बाहिर बस्नुहुन्थ्यो छाउगोठमा। मैले मेरो दिदीलाई पनि सोधेँ किन तपाईँहरू बाहिर बस्नुहुन्छ भनेर, अनि मेरो दिदीले पनि कहिले भन्नु भएन कि किन बाहिर बस्छ, कतिखेर बाहिर बस्छ, के भएपछि बाहिर बस्छ भनेर। सो मैले मेरो घर परिवारबाट कहिले पनि इन्फर्मेसन पाएन महिनावारीको बारेमा। त्यसपछि जब स्कुल लेभलमा म पढ्न गएँ 6-7 क्लासमा स्वास्थ्यको किताबमा यस्तो कुराहरू थियो, तर हाम्रो सरहरूले चाहिँ कहिले पनि पढाउनु भएन। यो च्याप्टरलाई चाहिँ एकदम स्किप हानिदिनुहुन्थ्यो, कहिले पनि यसको बारेमा पढाउनै चाहनु भएन र विद्यार्थीहरू पनि एकदम धेरै लजाउने, यो कुरालाई लिएर पढ्नै नचाहने। म आफै पनि एउटा त्यस्तै विद्यार्थी हुँ, किनभने मलाई पनि त्यतिखेर लाज लाग्थ्यो यो विषयमा पढ्न टिचरहरूले पढाउँदाखेरि। अनि त्यसपछि चाहिँ स्कुलबाट पनि इन्फर्मेसन पाएन र घरबाट पनि मैले मेन्स्ट्रुएसन सम्बन्धी इन्फर्मेसन नपाएपछि चाहिँ मलाई चाहिँ अब एउटै मेरो दिमागमा के बस्यो भनेपछि मेरो दिदी र मेरो आमालाई चाहिँ बाहिर बसेको देखेर मलाई लाग्यो कि महिनावारी मेन्स्ट्रुएसन चाहिँ वुमनसँग मात्र रिलेटेड छ भनेर। अनि अनेस्टली भन्दाखेरि मलाई त्यो उमेरमा थाहा पनि थिएन कि फिमेलको अर्ग्यान कस्तो हुन्छ, बडीली एनाटोमी र मेलको अर्ग्यान कस्तो हुन्छ भनेर मलाई थाहा थिएन। किनभने त्यो पढाइएन पनि मेरो स्कुलमा। म एकदम गभर्मेन्ट स्कुलमा पढायो र गाउँतिरको स्कुलहरू तपाईँलाई थाहै छ कस्तो हुन्छ भनेर। सो थाहा नभएपछि मैले सानैदेखि आफूलाई एउटा केटा जस्तो फिल गरेको थिएँ। म चाहिँ केटा हो, आइएम अ बोय, म चाहिँ गर्ल्स चाहिँ होइन। किनभने मलाई एकदम केटा मान्छेको गेमहरू मनपर्ने र त्यो एउटा फिलिङ चाहिँ म भित्र थियो कि मलाई कसैले छोरी भनेर नभनोस्, म छोरा हो भन्ने तरिकाको। अनि मलाई के लागेको थियो भने म चाहिँ मेन्स्ट्रुएसन हुँदैन, किनभने म चाहिँ केटा हो, म मेन्स्ट्रुएसन हुँदैन, मेरो दिदी, मेरो बहिनी, मेरो मम्मी मात्रै हुन्छ र छोरीहरू मान्छे मात्र हुन्छ, म चाहिँ मेन्स्ट्रुएसन हुँदैन भनेर मलाई थाहा थियो, मलाई चाहिँ फिल थियो भित्र। तर फर्स्ट टाइम म 14 वर्षको थिएँ, 9 क्लास ठ्याक्क सकेको थियो मेरो, म पहिलोपटक मेन्स्ट्रुएसन भएको थिएँ र मैले मेरो शरीरबाट, मेरो भजाइनाबाट चाहिँ ब्लड बग्दाखेरि चाहिँ म यति धेरै डराएँ कि मैले कसैलाई भन्नै सकिनँ के भइरहेछ भनेर। मेन्स्ट्रुएसन हो भन्ने पनि थाहा छैन कि मलाई, मैले ब्लड बगेको मात्र देखिरहेको छु, मैले भन्नै सकिनँ। त्यसपछि म त्यो एकदम धेरै डराएर लजाएर चाहिँ म जाँदै थिएँ। अनि मेरो मामीले चाहिँ फर्स्ट टाइम मेरो त्यो ब्लड देख्नुभयो। अनि मैले चाहिँ सेतो कलरको सुरुवाल लगाएको थिएँ, जुन चाहिँ यो कराते टेकान्डो खेल्दाखेरि लगाउँछन्। सो त्यो लगाउँदाखेरि मेरो मामुले देख्नुभयो। अनि पश्चिमको भाषामा चाहिँ यसलाई छुई भनिन्छ कि, अनि तँ चाहिँ छुई भइस् कि क्या हो, किन भित्र गइरहेको, भित्र नजा भन्नुभयो। त्यसपछि म बल्ल थाहा पाएँ कि यसलाई चाहिँ भित्र नजानुको कारण चाहिँ त्यही भएर रहेछ मैले भन्ने थाहा पाएँ। अनि बल्ल मेन्सुरेसन अनि मेरो फर्स्ट क्वेसन मेरो मामुलाई के थियो भने म चाहिँ छोरा मान्छे हो म किन मेन्सुरेसन भएको त म नहुनुपर्ने हो भन्ने चाहिँ मैले फर्स्ट क्वेसन गरेको थिएँ अनि मेरो मामुले त्यतिखेर एकदम भनौँ न त्यो कुराहरू अहिले थाहा छैन तँलाई ठुलो भएपछि थाहा हुन्छ भन्ने तरिकाले सम्झाउनु भएको थियो त्यहाँदेखि मैले अहिलेसम्म चाहिँ मेरो मेन्सुरेसनलाई चाहिँ एक्सेप्ट गर्न सकेको थिएन मेरो मेन्सुरेसनको बारेमा खुलेर कुरा गर्न सकेको थिएन डिस्कस गर्न सकेको थिएन मेरो मेन्सुरेसनको बारेमा कसैलाई सेयर गर्न सकेको थिएन तर फर्स्ट टाइम म जब राधा पौडेल फाउन्डेसनसँग जोडिएँ त्यसपछि चाहिँ मैले मेरो मेन्सुरेसनले चाहिँ डिग्निटी पाएको चाहिँ महसुस गरेको फर्स्ट टाइम चाहिँ किनभने मेरो स्कुलमा पनि ट्रान्स मेन्सुरेसनलाई लिएर कुरा भएन मेरो साथी सर्कलमा पनि मेरो आफै कम्युनिटीभित्र पनि अनि मैले काम गर्ने संस्थाहरूले पनि कहिले पनि ट्रान्स मेन्सुरेसनलाई लिएर कुरै गरेनन् तर जब फर्स्ट टाइम चाहिँ म राधा पौडेल फाउन्डेसनसँग कनेक्ट भएँ त्यसपछि चाहिँ मैले मेरो मेन्सुरेसनको बारेमा अझ धेरै थाहा पाएको हुँ र यो रिपोर्ट चाहिँ राधा पौडेल फाउन्डेसन र युनिटी फर चेन्ज मिलेर चाहिँ दुईवटा संस्थाको कोल्याबोरेसनमा गरेको हो र यो प्रेजेन्टेसनको बारेमा तपाईँलाई सर भन्छु ओके सो अब मेन्सुरेसन डिस्क्रिमिनेसन भन्ने बित्तिकै अब सरी ओके अब महिनावारी विभेद भन्ने बित्तिकै अब एकदम स्टिकमा बुलिङहरू सहनु अनि महिनावारी रिलेटेड प्रडक्ट्सहरू सर्भिसहरू चाहिँ लिन नपाउनु त्योबाट वञ्चित हुनु हो अनि अर्को भनेको ट्रान्स मेन्सुरेसनलाई चाहिँ कुनै पनि पोलिसीमा कुनै पनि नीतिमा समेटेको छैन र ट्रान्स मेन्सुरेसन सम्बन्धी कुनै पनि अनुसन्धान पनि भएको छैन अहिलेसम्म र अर्को भनेको चाहिँ जस्तै ट्रान्स मेन्सुरेसन चाहिँ एउटा सामाजिक बहिष्कार अनि पहिचानको अभाव र आफ्नै बडीलाई लिएर पनि एक्सेप्ट गर्न नसक्ने कुराहरूसँग चाहिँ जोडिएको छ अनि अर्को भनेको चाहिँ ट्रान्स मेन्सुरेसन सम्बन्धी हरेक ठाउँमा चाहिँ इन्फर्मेसनको कमी छ अनि अब अघि बिहानदेखि कुरा आइरहेको छ ट्रान्स मेन्सुरेसनलाई लिएर भनौँ न कम्युनिटीलाई लिएर ट्रान्स पर्सनहरूलाई लिएर स्पेसिफिक टोइलेटहरू छैन सो वासको सुविधाहरू छैन अब यो रिपोर्ट चाहिँ यो रिपोर्ट गर्नुको यो रिसर्च गर्नुको मुख्य उद्देश्य भनेको त पहिलो चाहिँ ट्रान्सम्यानहरूको महिनावारी सम्बन्धी अभ्यासहरू कस्तो छ भनेर चाहिँ जान्नको लागि हो र अर्को भनेको चाहिँ त्यो अभ्यासहरूले चाहिँ ट्रान्सम्यानहरूको लाइफमा जीवनमा चाहिँ कस्तो किसिमको प्रभाव पारिरहेको छ र त्यो प्रभावहरू के हो भन्ने कुरा पहिचान गर्नु हो अनि अर्को भनेको चाहिँ महिनावारी विभेद अन्त्यका लागि चाहिँ अब नीतिगत खाडलहरू के कस्तो छ त होइन ट्रान्स मेन्सुरेसनलाई लिएर चाहिँ भनौँ न यो लहरू पोलिसीहरू चाहिँ के छ भन्ने कुरा पनि हो यसको उद्देश्य भनेको चाहिँ अनि अर्को भनेको चाहिँ अब यो रिपोर्टको मेथोडोलोजी भनेको के हो भनेको चाहिँ अब यसमा चाहिँ हामीले पहिलो चाहिँ अब एउटा यस्तो मिटिङहरू गरेको थियौँ समूह बैठकहरू जसमा चाहिँ 30 जना ट्रान्सम्यानहरूको सहभागिता थियो अनि अर्को भनेको चाहिँ अनलाइन सर्वे गरेको थियौँ अनलाइन सर्वेमा चाहिँ 15 वर्षदेखि 49 वर्षसम्मको उमेरका ट्रान्सम्यानहरू 52 जना चाहिँ सहभागी हुनुभएको थियो 52 अनि त्यसपछि अर्को भनेको चाहिँ पोलिसी रिभ्यू पनि गरेको थियौँ 2007 देखि 2024 सम्म बीचमा बनेका कानुनहरू नीतिहरूमा चाहिँ हामीले रिभ्यू पनि गरेका थियौँ ट्रान्स मेन्सुरेसनलाई लिएर र की फाइन्डिङ्सहरू चाहिँ अब धेरै जति पनि सहभागीहरू हुनुहुन्थ्यो उहाँहरूलाई चाहिँ अलिकति मेन्सुरेसनको बारेमा अलिकति वैज्ञानिक साइन्टिफिक ज्ञान चाहिँ थिएन उहाँहरूमा अनि अर्को भनेको चाहिँ उहाँहरूले चाहिँ अब 5 देखि 9 वर्षको उमेरमा चाहिँ आमा बुवा दिदीबहिनीहरूबाट आफ्नो साथीहरूबाट चाहिँ पहिलोपटक मेन्सुरेसनको बारेमा सुन्नु भएको हो अनि उहाँहरूको फर्स्ट मेन्सुरेसनको अनुभव चाहिँ एकदम धेरै डरलाग्दो एकदम आत्तिने एकदम स्पष्ट नहुनु मेन्सुरेसनलाई लिएर सो त्यस्तो खालको एउटा फिलिङ थियो अनि धेरै पहिलो महिनावारीमा चाहिँ अब सबैजनाले चाहिँ अलिकति भनौँ न त्यो कलङ्क त्यो भेदभावहरू त्यो स्टिग्माहरू चाहिँ फेस गर्नु भएको थियो अनि अर्को भनेको चाहिँ 34% ट्रान्सम्यानले मात्रै महिनावारीको बारेमा अलिकति थाहा थियो उहाँहरूलाई चाहिँ नलेज थियो उहाँहरूले आफ्नो एक्सपिरियन्स पनि सेयर गर्नुभएको छ त्यहाँ तपाईँहरू पढ्न सक्नुहुन्छ सो अर्को भनेको चाहिँ अब यो रिपोर्टमा यो सर्वेमा चाहिँ भाग लिनु भएको चाहिँ ट्रान्सम्यानहरूको पहिलो मेन्सुरेसनको बारेमा कुरा गर्दाखेरि चाहिँ उहाँहरू सबैजना 10 देखि 13 वर्षको बिचमा चाहिँ फर्स्ट मेन्सुरेसन हुनुभएको थियो र सबैजनाको अब मेन्सुरेसन प्रतिक्रिया त्यही थियो फिलिङ चाहिँ सो अनि उहाँहरूले भोगेको कुराहरू चाहिँ जस्तो उहाँहरूले पनि मेन्स्ट्रुएसन हुँदाखेरि चाहिँ आफ्नो परिवारको पुरुष साथीहरूलाई चाहिँ छुन पाउनु भएको थिएन, भेट्न पाउनु भएको थिएन। अर्को भनेको एकदम बन्देजमा राखिएको थियो, अलग राखिएको थियो, उहाँहरूलाई छुट्याइएको थियो र खानेकुराहरूमा पनि बन्देज लगाइएको थियो, जस्तै त्यो दुध दहीहरू खान नहुने भन्ने तरिकाले। अनि अर्को भनेको चाहिँ पूजापाठ गर्न धार्मिक स्थलहरूमा चाहिँ जान नपाइने भनेर रोक लगाइएको थियो। सो अर्को भनेको उहाँहरूले युज गर्ने कपडाहरू, प्याडहरू चाहिँ लुकाउनु पर्ने अवस्था पनि उहाँहरूले फेस गर्नुभएको थियो। अर्को भनेको चाहिँ अब डिस्क्रिमिनेसन अक्रस सेटिङमा चाहिँ अब जस्तो कति ठाउँमा डिस्क्रिमिनेसन हुन्छ भन्ने कुरामा चाहिँ एउटा चाहिँ आफैमा पनि हुन्छ डिस्क्रिमिनेसन। जस्तो कि आफ्नो जेन्डर आइडेन्टिटी मेल छ, ट्रान्सम्यान भनेर आफूले फिल गरिरहेको छ भने र मेन्स्ट्रुएसन पनि भइरहेको छ भने त्यो आत्मद्वन्द्व पनि हुन्छ आफैभित्र, किनभने त्यो एउटा पुरुष भएपछि मेन्स्ट्रुएसन नहुने भन्ने कारणले पनि। अनि अर्को भनेको चाहिँ नि डिस्फोरिया अनि भावनात्मक तनाव पनि हुन्छ। र अर्को भनेको चाहिँ हर्मोन प्रयोगद्वारा पनि धेरै ट्रान्सम्यानहरूले चाहिँ महिनाहरू रोक्नलाई चाहिँ ट्राई गरेको चाहिँ यसमा यो सर्वेले चाहिँ भनेको छ। सो यस्तो धेरै डिस्क्रिमिनेसनहरू उहाँहरूले फेस गर्नु परेको छ स्कुलमा, त्यसपछि आफ्नो काम गर्ने ठाउँमा, समुदायमा। अनि ओके, सो अब हामी चाहिँ ओके ल, अब चाहिँ वे फरवर्डमा जाँदाखेरि चाहिँ अब हामीले चाहिँ के गर्ने भन्ने कुरामा जाँदाखेरि चाहिँ अब यो भेदभाव त धेरै भोगिसक्नुभयो। यो सबै कुरा सबै ठाउँमा एउटै हुन्छ, स्कुलमा, विद्यालयमा, स्वास्थ्य दिने ठाउँमा, होइन। सो अब वे फरवर्डमा चाहिँ हामीले के गर्न सकिन्छ भने हाम्रो समुदायलाई, सोसाइटीलाई चाहिँ डिग्निफाई मेन्स्ट्रुएसनलाई लिएर र ट्रान्सम्यानको यो ट्रान्सम्यानहरू पनि मेन्स्ट्रुएसन हुन्छ है, उनीहरूले आफूलाई म्यान आइडेन्टिफाई गरे पनि भन्ने बारेमा चाहिँ बुझाउनु छ, शिक्षित गर्न आवश्यक छ। र अर्को भनेको चाहिँ सबै क्षेत्रहरूमा जस्तै विद्यालयमा, स्वास्थ्य क्षेत्रमा, कार्यस्थलमा चाहिँ डिग्निफाई मेन्स्ट्रुएसनको बारेमा, यो डिग्निफाई मेन्स्ट्रुएसन कसरी गराउने भन्ने कुराहरू चाहिँ लागू गर्न चाहिँ जरुरी छ। अर्को भनेको चाहिँ जति पनि मिडियाहरू छ मेन्स्ट्रुएसनलाई लिएर न्युजहरू लेख्ने, स्वास्थ्यलाई लिएर न्युजहरू लेख्ने, उहाँहरूले चाहिँ ट्रान्स मेन्स्ट्रुएसनको बारेमा पनि लेख्नु पर्यो, बोल्नु पर्यो। र त्यसको लागि पनि हामीले भनौँ न समावेशी तरिकाले न्युजहरू लेख्न आवश्यक छ। र अर्को भनेको चाहिँ ट्रान्सम्यानहरूलाई चाहिँ महिनावारी र यसको व्यवस्थापन र अधिकारबारे चाहिँ ज्ञान प्रदान गर्न पनि जरुरी छ, किनभने कम्युनिटीभित्र र आफै पनि आफ्नो मेन्स्ट्रुएसनको बारेमा धेरैलाई चाहिँ ल्याक अफ नलेज छ। सो यो चाहिँ त्यति हो। हस्, थ्याङ्क यू।
Thank you so much, Anu Shahi, and we're sorry since we have to move on time. Now we will directly move to the panel discussion, and in this panel discussion, I would like to, okay, where's the document? Without any delay, I would like to call upon the moderator, and our moderator would be, okay, just Mr. Joshi. Mr. Joshi from AHF Nepal. So he is currently the country manager. He's been working in this field with TB, HIV, and public health program management for over 15 years. And he's an expert as well as experienced professional in the field of public health and business administration. Now I'd like to provide this dice to Mr. Joshi.
Thank you so much. Namaste, good afternoon, good evening. So thank you so much for providing this opportunity to me to moderate this session. So we'll be here as a panel, and I'll be moderating the session. So it is actually, the panel will be on the dignified menstruation and inclusion, especially for gender minorities, and we have panel on this. So before we start the panel, I'll introduce briefly on the session about the session dignified menstruation that I earlier mentioned while we talked about sexual reproductive health and rights. So it is not only the health issue, but also a human right issue. So it is a right issue that directly affects and influences the safety, autonomy, and equality for all, including LGBTQIA plus individuals, stigma, discrimination, and exclusion around menstruation often fuels gender-based violence while limiting access to the essential services, SRH information for LGBTQIA plus people who menstruate. The barriers are multiplied, ranging from lack of recognition to unsafe environment, then increase the vulnerability to GBV and HIV as well as STIs. By promoting dignity, accurate information, and inclusion services, dignified menstruation become a powerful prevention tool that reduces the harm, strengthens the well-being. Today, we'll be discussing and we'll be exploring how policy, the community engagement, and service delivery can transform menstrual experiences into a pathway for empowerment and protection. So we have the panel, and our panel will also highlight on practical strategies and lived experiences that show why dignified menstruation must be central to HIV prevention and GBV responses effort. So without delay, I would like to introduce our panel. So I will be, some of the panelists from this session will be joining online. So the very first panel, I would like to welcome Obioma, who is founder and executive director of Intersex Nigeria, and he is a Nigerian intersex and human rights advocate, and founder and executive director of Intersex Nigeria, the country's first intersex-led organization advancing awareness, rights, and well-being of intersex people. So welcome on board, Obioma. I think he must be connected, not sure on that. Please welcome Obioma. So our second panelist, Avali Khare, who is a queer feminist, and we already had seen her in the stage as well. So over 6 years of experience advancing LGBTQIA plus right, comprehensive sexual education, and SRHR in Global South. They currently lead regional advocacy on health rights for transgender and gender diverse people at Asia Pacific Transgender Network in Bangkok, and serve as youth advisor to the FRIDA Fund, FRIDA Fund. So welcome on board, Avali. Please be on the panel. Welcome you. And our third panelist is Sharmila. Sharmila is a researcher and a program practitioner with expertise in gender justice, SRHR, and public policy, based in Bangkok, Thailand. She works as researcher at ECPAT International, focusing on child sexual exploitation and abuse, and as Secretariat Liaison Officer at Radha Paudel Foundation, Global South Coalition for Dignified Menstruation, advancing feminist advocacy on dignified menstruation globally. Welcome, Sharmila. Please give a big round of applause to Sharmila. Our fourth and final panelist is Anu, Secretary of Unity of Change. Anu is originally from Calicut. So already got a brief introduction in the research paper that they have produced, and is a transgender man currently pursuing a bachelor's degree in journalism and political science. He serves as a central committee member of Dignified Menstruation Committee Nepal. Anu works as a researcher at Shanti Foundation, focusing on discrimination, workplace condition, and SGBV experienced by LGBTQIA plus individuals in the entertainment and hospitality sector. Welcome, Anu. So sorry for introducing myself at the last, because I want to introduce our panels first because I am moderating. Namaste once again, I am Divya. I work for 𝐃𝐢𝐠𝐧𝐬𝐭𝐫𝐿 Foundation, and I work as Country Program Manager for 𝐃𝐢𝐠𝐧𝐬𝐭𝐫𝐿 Foundation. So starting with the panels, I'll be taking the seat with our panelists. So going with the panel, I think because we have to appreciate the session. We are at the conference. This is learning conference, and I think it's a very big opportunity that Global South Coalition for Dignified Menstruation, they work and has shown that they defined inclusion with the dignity. And I would like to congratulate the conference organizer for this inclusion. Please give a big round of applause to Global South Coalition for Dignified Menstruation before we start the panel discussion. So our first panel, Obioma, because you are online, can you hear us clearly?
Yes, I can hear you clearly. Can you hear me?
Yeah, we can hear you. So Obioma, so our first panel, I go with the panel discussion question, the first question with you. Through your leadership in intersex Nigeria and your research on integrating intersex perspective into policy, how do you see binary framing of menstruation affecting intersex peoples? Bodily autonomy and access to care, especially in African contexts. Over to you.
Thank you so much for that question. And namaste to everyone over there. My name is Obioma Chukwuike. My pronouns are they, them, and I'm from Nigeria and I live in Nigeria. To respond to your question, I would say that across many African societies, menstruation is framed, it's framed as a female experience. And this binary thinking visibilizes intersex bodies entirely beyond even menstruation. For intersex people, menstruation or the absence of it is often weaponized. And there's a question around, and these questions around questions our dignity, our womanhood or manhood, or even our bodily autonomy, the right to bodily autonomy. And that is where the center of this conversation is, around how some group of population who exist with other society, within society, but their experiences are often, excluded from the larger conversations like menstruation. In healthcare settings, binary assumptions leads to misdiagnosis because most times there are no context of intersex experiences or intersex body in the healthcare system. And this also further leads to coerced medical interventions, which we have been hearing from different intersex persons from time to time of how their body are being coerced into unnecessary surgeries that are not, necessary for their well-being, for their both physical and mental well-being. Instead, it leaves scars, trauma, pain, and life cycle of stigmatization that comes with it. And this stigmatization has also, made intersex people not to trust healthcare providers, especially when it comes to menstrual hygiene or menstrual management. And I sometimes do not blame those medical practitioners because adequate training from what we have seen across the continent, adequate training around intersex body, variations of intersex body is not, holistically taught in their school or in their curriculum. So this leaves the healthcare practitioners with that gap of not understanding intersex variation. And for some persons that are in the room that might be questioning what is intersex, intersex is people that have variations in their sex characteristics that do not match or fit into the typical definition of female people that have variations, sex characteristics variations in their hormones, in their gonads, in their genitals, that do not typically conform to the definition medically and societally of what has been defined as male or female body. Just to conclude, before I hand it over to you, I also want to share that this situation also goes into the community life of intersex persons who also face stigma when they menstruate, especially when they identify as a male, and when they do not menstruate, when they identify as a female. So this leaves them, being questioned in very different contexts and traditional settings when their womanhood are being questioned because they are being sometimes labeled as witch, taboos, because their body do not conform to menstruation. And also the products too, but I also speak about it maybe as we go further in the conversation about how the products, menstruation products, also exclude intersex people. This exposes that it is very important that intersex people should be part of this conversation because there has been systematic violence that has come up through the stigma and violation that we have been experiencing over time. And how care is also important because inaccessibility can also lead to stigma, and that can also lead to violence. So when we are talking about holistic care around menstrual hygiene or menstrual dignity, it is very important to bring people who have not been expand that gender conversation. I heard when the trans man was talking about how they never knew about menstruation till they were adults, which is not meant to be. Every gender should understand what menstruation means, how to support and care for people who are experiencing menstruation, and not to exclude them in wider conversations, and also protecting them from different forms of gender violence, which is very, very important, and to ensure that everybody has full access to what they need as a human being to exist. So it's very important that intersex people are included in these conversations. Bodily autonomy becomes non-negotiable, and the needs and care of intersex people, which we have seen has not been in any discourse for the longest of time, is included as a conversation. And I'm happy that we're doing that in this panel. Thank you.
Thank you. As you have already very detailed that how it is important to put in the central dignified menstruation, and how the stigma and discrimination associated with bodily autonomy has been affecting the community, especially the gender minorities and intersex. So we'll be leaving the questions if they have any with the audiences. So after we complete the rounds, then we can go to the audience if they have any questions or confusions. So going with the second panelist, please let us keep on mind with our time as well. We have allocated 3 minutes each speakers so that we give space for next session. I will go with Avali. So Avali, your advocacy spans for SRHR, CSE, and rights of gender diverse communities across the global south. How do menstrual narratives grounded in the gender binary create exclusion for queers, trans, and gender diverse people, especially in health system and education? So I think this is more related to the accessibility or having access or taking the services or its utilization.
Okay, thank you so much, Divya sir, for the question. And before I begin, I just want to say that I'm really excited that we are having space for a conversation like this in a conference, international conference on menstruation. Having worked on sexual and reproductive rights, comprehensive sexuality education for the past decade or so within Asia Pacific, I know how rare these conversations are generally. Also acknowledging that they are rare within trans rights spaces and queer rights spaces. I feel like we do not talk enough about sexual and reproductive health within our own activism and our movements. So this goes both ways. So I like the fact that we are creating the space where we're bringing all of activists from different spaces together. Having said that, now to answer your question, I think having done the work of implementing a lot of sexual and reproductive rights programs and CSE programs in schools and out of school settings in India, I mean, that's where my work was largely focused for 7 years or so before I moved to Bangkok to do work on a regional level. I think the narratives and the perspective of these programs are often rooted in this understanding that the audience that they are addressing or the people that they are engaging largely come from cisgender and heterosexual backgrounds. So the idea is that mostly are the people who are consuming our programs and people who are our target groups, they are cisgender or they are heterosexual, as in they have identify with the gender they are assigned at birth, and they are attracted to people of the opposite sex. This is the primary assumption. When we go into programming with this kind of assumption, mostly with interventions from queer rights activists, now what these programs have started doing is they say, okay, we are, our audience is diverse, we address all young people, we address all people who come from different gender, different sexuality. But that's often as much as that inclusion is limited to. So these programs still do not address like specific needs of these populations. For example, when we talk about menstruation in like these settings, what are specific like menstrual health or menstruation related needs of like trans people, queer people? In Annu's presentation also they were highlighting earlier the idea that a lot of trans people struggle with experiencing menstruation in general because that feels dysphoric or can cause feelings of incongruence, gender incongruence. So how do they delay these periods if they want to through their puberty? So there is, within trans spaces, we know that there are puberty blockers that a lot of like trans people access these days that ensures that if they are experiencing like confusion around their identity, they can take that time before entering into puberty, something like that. Or something, information around if you start taking testosterone, it's not always necessary that your periods will stop. You can still continue menstruating even after starting testosterone. And sometimes you have to be prescribed like progesterone along with testosterone to stop like periods, something like that. Or like the fact that if you are a trans mass person who's wearing like underwear that's designed for a male like physique, like boxers, for example, you can't really use like pads with underwear like that. So you need to be aware of more different kind of menstrual products that exist. This kind of information just is not sort of distributed through larger like SRHR or CSE programming. So first, that creates an information and knowledge gap where trans people themselves do not have enough information that they need around menstruation, right? That's one issue. The second is, of course, then that translates into a medical healthcare gap where medical curriculums don't talk about, gender diverse bodies. So healthcare provision does not address needs of transgender people and gender diverse people. And these are already communities, as our earlier panelists share, these are already communities that have deep distrust of healthcare providers in general. So, it's generally hard to access healthcare services, and then you add this stigma around like SRHR around menstruation, it becomes even harder. So that's a gap. Largely, and I will end there, I know I'm taking a bit of time, but where I will end is, this also translates then into a legal and policy framework gap, where, even in this conference, like we're talking a lot about, menstruators and people who menstruate. There's a reason why we're using that terminology, right? Because we know that like not everybody who menstruates identifies as a woman, right? But this often does not translate into a policy and law understanding. So a lot of laws, policies around like menstruation, menstrual health management still talk about it from a woman perspective, if at all, right? In most countries in the Asia Pacific, you don't even have laws governing like menstrual rights. But like there are good examples around SRHR laws, particularly like, for example, coming from India, where like there have been progressive Supreme Court judgments around abortion rights, for example, where they're talking about how abortion should not be limited to women, but pregnant people, and that's the language that the law should use. So just this kind of exclusion on a legal and policy level, that also makes access to menstrual like services, menstrual hygiene, health management generally. So I think like these are three different levels that we have observed at least implementing on ground.
Thank you, Avali. This is great. That in summarizing that, the thing is like assumption and reality, assumptions and programs. So what we see might be different that what we are experiencing. So to address it, we need some policy-related changes and a wider circulation or wider transmission of the information to have like, because this is also a platform that we are here as a panel and this is a learning conference, not for the people who are attending or for the delegates, but also for the people who will be listening throughout the program or later of the program, that what are the needs and how the services can be utilized. Thank you for the insights. To the third panel, Sharmila. So Sharmila, because you have lots of experiences on research and you have been doing advocacy across South Asia. So based on your expertise, including your recent work on dignified menstruation among trans men and LGBTQIA+ communities, what pattern of discrimination or invisibility do you see most clearly, especially in Nepal?
Thank you for the question. And I do not have a lot of research experience, but I have done a couple of research on LGBTQIA+ community and trans men in Nepal and also in the region. So from that, what I can tell is the pattern of discrimination, if you ask, I mean, already all the concerns have been, the patterns have been identified already, but just to sum it up, I could say use a term dual invisibility. They are invisible in the broader community and also in the policy spaces. When we talk about menstruation, it just women and girls. Even we could get that from the speeches yesterday, even from the government, people from the government, they were addressing, menstrual discrimination is an issue for women and girls. Just yesterday, I was listening that. And this happens in a lot of spaces. So there's one layer of invisibility, and another is inside the trans and, community itself. From the research, what I can tell is they're not even comfortable talking about issues on menstruation within their community. So that leads for them to manage menstruation by themselves because of the stigma and taboos that are surrounded to it. So they're not, they couldn't share it with other people, even friends, family, or person they are near to them. So that's, even for one of the study highlighted that they cannot even share it with the intimate partners. So you could imagine how painful that could be. And on top of that, that the partners would want them to be masculine enough. That forces them to be, to go under hormone therapy or even undergo surgical menopause, by removing it surgically. So that's that's something that I've noted from my research so far. So I'll just stop to that. Yeah.
Okay, thank you, Sharmila. So we got another aspect on this, a broader community representation and even representation within the community, especially in terms of what you are experiencing by yourself and how you express it to the next person. So it also determines the gravity. Going to the third panel, Anu. Fourth panel, I guess, third. Anu, we already have experienced your research paper, and from your perspective that you are closely working with the trans men and gender diverse individuals. So what you see most misunderstood or overlooked aspect of their menstrual experiences, especially by the individual itself, and if you go broader, by the society.
Hello. So I'll speak Nepali. Okay, so समाजमा चाहिँ अब महिलाहरूलाई ट्रान्स मेन्स्ट्रुएसनलाई लिएर मिसकन्सेप्सन. ओके, ट्रान्स मेन्स्ट्रुएसन लिएर समाजमा एउटा गलत बुझाइ के छ भने मेरो आफ्नै एक्सपिरियन्समा चाहिँ मैले भोगेको। सो फर्स्ट टाइम मैले प्याड किन्नलाई फार्मेसी जाँदाखेरि चाहिँ फार्मेसीमा बस्ने मान्छेको पहिलो क्वेसन थियो कि तिमी पनि महिनावारी हुन्छौ, तिमीहरूसँग पनि भजाइना हुन्छ या यौनाङ्ग महिनावारी हुने खालको यौनाङ्ग हुन्छ र भनेर क्वेसन सोध्नु भएको थियो कि। सो पहिलो मिसअन्डरस्टुड थट नै के छ भनेपछि LGBTQIA+ कम्युनिटीको मान्छेको यौनाङ्ग चाहिँ स्पष्ट हुँदैन, बिग्रिएको हुन्छ या हुँदैन भन्ने खालको पहिलो बुझाइ चाहिँ समाजको यो छ। धेरै ठाउँमा चाहिँ यो समुदायको मान्छेको यौनाङ्ग हुँदैन भन्ने बुझाइ छ। अनि अर्को भनेको चाहिँ कस्तो छ भने महिनावारी भन्ने बित्तिकै महिलालाई मात्र स्पेसिफिक गरिन्छ नि त। महिनावारी चाहिँ महिलासँग मात्र सम्बन्धित विषय हो र यो चाहिँ महिलाको बडीमा फिमेल असाइन बर्थमा जन्मेको मान्छेहरू मात्र महिनावारी हुन्छ र महिनावारी हुने मान्छे चाहिँ कपाल लामो भएको हुनुपर्छ, अलिकति फेमिनाइन हुनुपर्छ, फेमिनाइन लुकको हुनुपर्छ भन्ने खालको एउटा बुझाइ छ, त्यो भयो। अनि अर्को भनेको चाहिँ जस्तो कि मेरो आफ्नै एक्सपिरियन्समा पनि मैले भने महिनावारीलाई लिएर चाहिँ धेरै ठाउँहरूमा चाहिँ मैले अघि पनि भनिहालेँ कि कतिपय ठाउँहरूमा ट्रान्स मेन्स्ट्रुएसनको कुरा गरिँदैन भनेर। त्यो कारणले पनि हामीले चाहिँ आफ्नो मेन्स्ट्रुएसनलाई खुलेर कुरा गर्न सक्दैनौँ। अवालीले अघि भन्नुभएको थियो कि हामीले बक्सर लाउँछौँ, सो पेन्टी चाहिँ हामीले युज गर्दैनौँ। बक्सर भनेको चाहिँ जुन छोरा मान्छेले लाउनुहुन्छ अन्डरवेयर त्यो युज गर्छौँ र त्यसमा प्याड युज गर्नको लागि यति अप्ठ्यारो हुन्छ कि यति अप्ठ्यारो हुन्छ त्यो कसैले सायद भन्न पनि सक्दैन होला, जसले भोगेको छ त्यसले मात्र भन्न सक्छ। सो त्यो अब आफै पनि जसरी यो बाइनरी सिस्टमले भनेको छ नि महिला भएपछि पेन्टी लाउनुपर्छ, पुरुष भएपछि बक्सर लाउनुपर्छ भन्ने तरिकाको यही थटले र यही थट मेरो दिमागमा पसेको कारणले मलाई पेन्टी किन्नलाई पनि लाज लाग्छ के, किनभने मैले आफूलाई छोरा भनेको छु नि त, म छोरा जस्तो देखिन्छु नि त। सो मलाई पेन्टी किन्न जाँदाखेरि पनि मान्छेहरूले यसरी हेर्छ कि तिमीले पनि पेन्टी लाउँछौ भन्ने तरिकाले मात्र सोध्न मात्र सक्दैन के। अनि अर्को भनेको चाहिँ अर्को एउटा गलत बुझाइ के छ भनेपछि जस्तो धेरै कुरा त अवालीले भनिसक्नुभयो, जस्तो छोरा मान्छे भनेको चाहिँ अलिकति लाउड हुनुपर्छ, अलिकति थर्काउने खालको बोल्ड हुनुपर्छ हैन, अलिकति दारी जुङ्गा आएको हुनुपर्छ र छोरी मान्छे सफ्ट हुनुपर्छ, फेमिनाइन हुनुपर्छ, बिस्तारी बोल्नुपर्छ भन्ने जुन खालको सिस्टम छ हाम्रो सोसाइटीको, त्यो सिस्टमले गर्दाखेरि पनि सायद हामी आफ्नो शरीरसँग चाहिँ एकदम फ्रेन्डली हुन नसकेको हो कि आफ्नो बडीलाई एक्सेप्ट गर्न नसकेको हो कि भन्ने पनि मलाई फिल हुन्छ। अनि हामीले सर्जरी गर्नुको कारण, हर्मोन थेरापी लिनुको कारण के हो भनेपछि सोसाइटीले पुरुष भनेको त भनौँ न पुरुष जस्तो शरीरमा हुनुपर्छ, दारी जुङ्गा आउनुपर्छ, हट्टाखट्टा हुनुपर्छ, अनि लाउड आवाज भएको हुनुपर्छ भन्ने खालको एउटा बुझाइ छ नि त समाजको। सो त्यही भएर पनि सायद ट्रान्सम्यानहरूले त्यो अब सोसाइटीमा हुर्केर त्यही कुरा सिकेर पनि सायद हर्मोन लिन्छ होला, सर्जरी गर्छ होला जस्तो मलाई लाग्छ के। किनभने सोसाइटीले चाहिँ जस्तो मान्छे पनि पुरुष हुनसक्छ, यदि उसले आफूलाई पुरुष आइडेन्टिफाई गर्छ भने ऊ चाहिँ पुरुष हुन पाइन्छ भनेको भए सायद सर्जरी कसैले गर्दैन थियो कि, हर्मोन थेरापीहरू गर्दैन थियो कि हैन। यो पनि एउटा गलत बुझाइ छ। अनि अर्को एउटा गलत बुझाइ समाजमा के छ भने हर्मोन लिइसकेको मान्छे र सर्जरी गरिसकेको मान्छे मेन्स्ट्रुएसन हुँदैन भन्ने पनि गलत बुझाइ छ। जो अलरेडी पुरुष बडीमा सिफ्ट हुन्छ हर्मोन लिइसकेपछि ऊ मेन्स्ट्रुएसन हुँदैन भन्ने पनि गलत बुझाइ छ, किनभने ऊ पनि मेन्स्ट्रुएसन हुन्छ। जस्तो तपाईँको हर्मोनको कुराहरू लिँदाखेरि कहिलेकाहीँ हर्मोन गडबड भयो भने र तपाईँले महिनामा हर्मोन लिनुपर्छ र हर्मोन लिन एकचोटि ग्याप गर्नुभयो भने चाहिँ तपाईँ मेन्स्ट्रुएसन हुनुहुन्छ, यदि तपाईँले बटन सर्जरी गर्नुभएको छैन र पाठेघर फाल्नु भएको छैन भने। सो उहाँको मेन्स्ट्रुएसनलाई अब कसरी समेट्छ सरकारले भन्नु न, किनभने उहाँ त पुरुषकै शरीरमा हुनुहुन्छ, पुरुष जस्तो देखिनुहुन्छ नि त। अब शौचालयकै कुरा गरौँ, शौचालय महिला र पुरुषको मात्र हुन्छ होइन, अहिले पनि जहाँ पनि महिला र पुरुषलाई लिएर मात्रै छ। अब शौचालयको कुरा गर्दाखेरि मैले +2 पढ्दाखेरि 2 वर्षसम्म टोइलेट युज गरेको होइन, किनभने मलाई शौचालय युज गर्न फिमेलको पनि अप्ठ्यारो लाग्थ्यो, फिमेलको अप्ठ्यारो लाग्थ्यो र फिमेल आफै पनि म शौचालयभित्र जाँदाखेरि एकदम धेरै अक्वार्ड भएर हेरिदिनुहुन्थ्यो सबैले हैन। अब मेलको वासरुममा जाँदाखेरि मेलहरू अप्ठ्यारो मान्दिने भनेपछि हामी जस्तो मान्छेहरू टोइलेट कहाँ जाने, यो समुदायको मान्छेहरू ट्रान्स पर्सनहरू। त्यो कारणले चाहिँ मैले टोइलेट युज गरिनँ र युज नगरेपछि मेरो अलिकति यो पिसाबमा चाहिँ समस्या आएपछि म चेक गराउनलाई हस्पिटल गएको थिएँ र हस्पिटलको त्यो गाइनो सम्बन्धी डक्टरले पनि मलाई यही क्वेसन गर्नुभयो कि तपाईँसँग यौनाङ्ग कस्तो हुन्छ. सो म मेरो हेल्थ केयरको लागि गइरहेको छु, उहाँहरूले म माथि यति धेरै क्वेसन थुपारिदिनु भयो कि तपाईँको यौनाङ्ग कस्तो हुन्छ, तपाईँको पार्टनर कुन खालको जेन्डरको हुन्छ, तपाईँहरू कसरी सेक्स गर्नुहुन्छ. यो त त्यो रिलेटेड नै छैन नि त. मलाई जे चाहिएको डक्टरले त्यो दिनु पऱ्यो कि मेरो यौनाङ्गसँग उहाँहरूले क्वेसन गर्नु भएन होइन. सो यो मेरो यौनाङ्ग कस्तो हुन्छ भनेर पनि मैले बुझाउनु परिरहेछ समाजलाई. सो यो पनि एउटा मिसकन्सेप्सन छ जस्तो लाग्छ. अनि अर्को भनेको चाहिँ अब अहिले यति नै भनौँ.
Thank you, Anu. We really appreciate the way you expressed lived experiences as well as the feelings from the community, and it's the reality, the truth as well. So I think the time is up, but going with the session, we still missed many things because the introductory session, it was a bit long. So as we have 3 rounds of questions, but I will wrap it up with just 2 rounds, and we will only go for 1 more round now with each the participant, but keeping in mind we should limit the time by 1 to 2 minutes by each speaker, and I'd be very thankful to keep the time as well. So going back to Obioma, so I'll be Obioma. Hope you are listening. So drawing from your continental level leadership role, how can intersex movement and menstrual dignity movement collaborate more internationally and intentionally so that there are less diversification and we can have a comprehensive level of sexual reproductive health and rights for the gender minorities? Over to you. Am I clear? Okay, maybe we wait for the network. We have some problem. I go with the next speaker, Avali. So Avali, as someone deeply engaged in the youth and feminist organization, who has strategies and who is already involved in developing the tools, inclusive, comprehensive sexual education, digital activism, or youth-led research, meaningful change for LGBT and menstrual right. Is it possible from your aspect? And whatever you have engaged, how do you think about it?
Okay, I feel like I might say a bunch of things that everybody here is already doing and might already know, so I will try to wrap up earlier. But I mean, the strategies that work and that are necessary for communities advocating for these rights in general, it all begins with evidence generation activities, particularly evidence generation that involves community at all levels. So ensuring that data collection processes, the people who are collecting the data, people who are involved in research, the people who are dictating what that research would look like at every level, there is community consultation. Part of that evidence generation is already happening, like the study that Radha Paudel Foundation has done around menstrual discrimination against trans men in Nepal. My organization, APTN, we are kind of doing that research on a more regional level, so we are trying to get, understanding of menstrual access, menstrual discrimination from across Asia Pacific, finding representation from countries like Mongolia, Kyrgyzstan, Indonesia, most of Southeast Asia, a lot of South Asia, etc. So just evidence generation, and then using that evidence to push for better policies, better laws. And this involves laws that exist on national levels. There are, and policies that exist on national level. So in Thailand, for example, they are doing a lot of work within schools around information on menstrual health, menstrual discrimination, etc. But the problem with those existing programs is that they operate in a very gendered binary. So how do we produce evidence and then ensure that these programs that are already existing become more sensitized and inclusive of trans and gender diverse people? So that's one way. But the other is obviously also creating resources that speak to experience of transgender diverse people that are not boring. There are resources that are like podcasts, reels, videos, things, comic books, things that like young people are actually engaging with and can hold their attention and stuff like that. So informing those resources. Largely also just on a, this is the last thing I will say, on a legal and policy level, like a lot of the existing policies around menstruation in the Asia Pacific region are mostly deal with like two kinds of issues. One is like menstrual leave related problems on like a formal employment sector level, and the other is ensuring menstrual information, menstrual hygiene management is at a school level. But that leaves out a lot of like trans and gender diverse people, because you can see that within trans populations, them being hired in formal employment, the rates are very, very less, right? And there's like transgender diverse kids dropping out of school, rates are very high. So how do we ensure that these laws and policies that are restricted into these spaces also expand and like go beyond this to engage with like trans and gender diverse people? Like that's super necessary. And also then laws that are existing around like trans and gender diverse people's rights in these countries. Like in India, there's a law on trans people's rights called the Transgender Persons Protection of Rights Act of 2019. In that act, there are like specific provisions that talk about SRHR, HIV, SCI, STD provision, etc., but no mention of SRHR beyond that. No mention of menstruation, no mention of abortion, nothing. So how do we influence those laws and policies as well that exist for trans people's rights, right? So that's the last thing that I would say.
Okay, thank you. Just to add on that, we have to also look on the practical aspects, like implementation level. We have regional collaboration, policies, programs, but we should also focus more on the implementation, how it has been going, and its evaluation is very essential. So that's the great insight, Avali. I would like to jump in with Obioma again. So Obioma, are you clear with my question? So my question, it is the final round of question that how dignified menstruation movement collaborate more intentionally to build intersectional right-based advocacy at continental level or maybe at the regional level.
Thank you for that question. I think one of the things that we have to look at is the root cause of why we are experiencing this great margin of stigma, prevalence. And one of the lack of policy, like the speaker had mentioned. And one of the ways we can look at it is to ensure that there's holistic collaboration across communities. It enables everyone to table what their issue is, the intersectional issues, and also the unique issues, because we know that when there is no data, there is no policy, and when there is no policy, there is no protection, and we all know that what that means. So one of the things we can do is to find a way to have a co-creative policy agenda that positions menstrual dignity as part of sexual and reproductive rights for all, including those whose body does not fall within the binary understanding of female and male body. The second part is to look at knowledge exchange. It's very important that we exchange knowledge of what is happening in our different communities, the issues that we're experiencing, how they align together, and how they are also very unique. And that will help us to integrate, for instance, intersex perspective into menstrual health research, data systems, and also educational materials. Because educational materials is what will make sure that, for instance, healthcare practitioners understand how to provide non-discriminatory services to either trans people or intersex people, right? And also how to provide care that suits their unique needs while adopting menstrual dignity frameworks, Then the last part I want to share is around movement solidarity. Building coalition is very important. Across Africa, I'll be looking forward to coalitions coming together to ensure that there is everyone inside that coalition, intersex advocates, feminists, disability groups, queer organizers, working collectively to transform social norms and dismantle stigma. One thing about collaboration is not just a strategy, is a very unique and important necessary tool that we need across movements. As we are highlighting what each movement is experiencing, we are also, intertwining it together on how to come about maybe a unique solution that we can all push together through government and also through implementation on ground. Because I always share with people that when we have beautiful policies, We strive to have these beautiful policies, but when we have them, if the implementation is not on ground, we are still running around the same cycle. So implementation is very, very key as we come together. Thank you very much.
So the main thing is like we should have clear strategy, we should move on with the movement, we should have collaboration, and we should have solidarity. This is the basic insight. So the next I'm going to tweet Sharmila. Sharmila ji, so what opportunity do you see to embed dignified menstruation principle into global human right and feminist advocacy spaces, and how do you ensure LGBTQI plus boys lead this work?
Thank you again for the question. So, it's now, I'm pretty hopeful that, everyone who work on the spaces have been very much open-minded, and they've started talking about menstruation beyond hygiene and talking about dignity, menstrual discrimination in all other spaces. So that's a good point. But also to add on to that, we are being inclusive in terms of, talking about it, but the question is, how inclusive are we while we design programs, while we conduct research, while hearing voices from the people who are actually living the experience. I think when we do that, I cannot ensure it will be a very sudden change, but by little, I think we will get there. But it's very important to hear the voices of the people who are actually living it. Yeah.
Great. This is about the reality. Not only making program or plan makes it reality, but while implementing, we should consider that they are really reflected and included and implemented well. So I think this is the key learning from your...
Okay, so just to add, just wanted to highlight one of the findings from the study. I thought we are here on the space, I should just talk about it. Like when Anu mentioned earlier, their experience of, getting treated by a service provider in a healthcare setting. I think the sensitization around this issue should start, very early. Is a young child, and school plays a vital role in it. And I think when we do conduct research among young people, they don't seem to quite have a basic understanding or awareness that of a simple fact that when we teach, for example, in the curriculum we teach children about a family, like what do you show when you teach a child how a family should look like? It's always, if you remember, if you recall, it's always a picture, and inside a frame there's a man and a woman and a child, right? I think we can start as low as that by maybe changing it to showing that the family could also consist two men and a child. Maybe two women and a child, just to, give them a food of thought, and to start from there, like, very small thing, but very thoughtful, and make them question, bigger topics when they grow up. Yeah, just add it.
So going to Anu. So this is the last panel question, so we'll be wrapping up. So Anu, from your aspect, just in 2 sentences, what specific policy or service-related changes would create the greatest shift in ensuring privacy, safety, and dignity for trans men during menstruation? Just in 2 points.
So अब ट्रान्समेन्स्ट्रेसनलाई लिएर समावेशितामा कसरी उतार्ने भन्ने कुरालाई हेर्दाखेरि जस्तो नेपालमा एसआर आचार सम्बन्धी कानुनहरू छ जसमा चाहिँ अवालीले पनि भनिहाल्नु भयो कि महिनावारी भन्ने बित्तिकै कानुनहरूमा पनि महिलालाई स्पेसिफिक छ होइन। सो त्यो कानुनहरू चाहिँ जेन्डर भनौँ न जेन्डर इक्वालिटीको आधारमा चाहिँ समावेशिताको आधारमा चाहिँ कानुन बनाइनु पर्यो जस्तो एउटा त्यो भयो है। अनि त्यो कानुनमा चाहिँ जेन्डर न्युट्रलहरू जेन्डर फ्रेन्डली वर्डहरू युज गर्नु पर्यो जस्तो कि महिनावारी हुने महिला किशोरी छोरी होइन कि महिनावारी हुने व्यक्तिहरू पाठेघर लिएर जन्मेका व्यक्तिहरू भनेर पनि सम्बोधन गर्नु पर्यो। ल महिनावारी हुने महिला भनेर सम्बोधन गरे पनि अरू बुदाहरूमा पनि ट्रान्सम्यानलाई समेट्नु पर्यो, ट्रान्समेन्सुरेसनको अधिकारलाई पनि कानुनमा समेट्नु पर्यो। त्यो भयो। जस्तो अर्को एउटा महिनावारीको कानुन भने र त्योसँगै अर्को भनेको चाहिँ मदरहुडको कुरा पनि आउँछ मातृत्वको। जस्तो कि हामीले जेन्डर आइडेन्टिटी सेक्सुअलिटी सेक्सुअल ओरिएन्टेसनलाई सँगै एकदम जोडेर हेर्छौँ नि, यो चाहिँ एकदम गलत हो। किनभने सेक्सुअलिटी एकदम डिफ्रेन्ट कुरा हो, जेन्डर आइडेन्टिटी डिफ्रेन्ट हो, सेक्सुअल ओरिएन्टेसन डिफ्रेन्ट कुरा हो। जस्तै मैले आफूलाई ट्रान्सम्यान भन्छु र म चाहिँ भनौँ न म सर्जरी गर्न चाहन्छु होला, म हर्मोन थेरापी गर्न चाहन्छु होला, तर कुनै ट्रान्सम्यानले आफूलाई ट्रान्सम्यान भनेर आइडेन्टिफाई गर्छ तर उसको सेक्सुअलिटी चाहिँ होमोसेक्सुअल हो, ऊ म्यानसँग नै अट्र्याक्ट हुन्छ भने उसको मदरहुडको अधिकार कसले सुनिश्चित गर्छ? उसले आफूलाई पुरुष भनेर चिनाइरहेको छ तर उसले आफ्नो पेटमा गर्भ पनि लिन चाहन्छ, बच्चा पनि जन्माउन चाहन्छ किनकि उसँग पाठेघर छ, उसँग बच्चा जन्माउन सक्ने योग्य छ, ऊ क्षमता छ भने उसले आफूलाई पुरुष भनेर चिनाइरहेको छ भने उसको मदरहुडको मातृत्वको अधिकारको जिम्मा कसले लिने? सो यो कुरा मातृत्व सम्बन्धी अधिकार सम्बन्धी कानुनमा पनि ट्रान्स पुरुषहरूलाई समेट्नु पर्यो किनभने उनीहरू पनि बच्चा पाउन योग्य छन् र बच्चा पाउन सक्छन् कुनै ट्रान्सम्यानले इफ चाहे भने उनीहरूले। र अर्को भनेको अवालीले पनि भनिहाल्यो अब्रेसनको कुरामा। सो कानुनको पाटोलाई हेर्दाखेरि अब्रेसन कुनै ट्रान्सम्यानले बच्चा गर्भमा लिएपछि अब्रेसन पनि गर्न चाहला अरे होइन, भोलि उसलाई एउटा सोच होला अरे। सो अब्रेसनको पाटोलाई हेर्दाखेरि अनि मदरहुडको कुरालाई हेर्दाखेरि मेन्स्ट्रुएसनको कुरा हेर्दाखेरि सबै महिला स्पेसिफिक कानुन छ जसले गर्दा हाम्रो ट्रान्समेन्स्ट्रुएसनलाई समेटेको छैन। अनि अर्को भनेको हेल्थ प्रोभाइडरहरू जति पनि हुनुहुन्छ स्वास्थ्य सम्बन्धी काम गर्नेहरू स्वास्थ्य कर्मीहरू।
We stop here because we have taken a lot of time and it doesn't seem very good to see the time up at your head. So we'll go with the question and answer session from the delegates, audiences, and then we'll be wrapping it up. So thank you to our panel. So please be ready to respond to the questions or comments if anyone has any.